Hi, I'm Jenny D'Olympia. I served 5 years active duty and 4 years in the Air Force Reserves as an intelligence officer. I am also part of a military family. My husband has been in service for 22 years. After my first deployment, I thought I'm not going to be in the military until retirement, so I started planning for the future by going back to school. I'm the director of the Military Veteran Psychology and the Trained Vets to Treat Vets programs at William James. The Military and Veteran Psychology program is an academic concentration. Our students might be veterans and military members and even family members of veterans, and some students who have no experience working with military veterans ever in their lives. They're all welcomed into the program. There's a need for mental health services for our military and veteran populations. Only about a third of them seek services. It's important for the community to know the high rate of post-traumatic stress disorder and death by suicide for our military and veteran populations. Our veterans and military members and even family members of veterans bring that life experience of working really hard when life is tough, and that transitions really well into graduate school. As a military veteran, I feel supported on the staff here. We also go the extra mile for our military students. That contributes to the cultural understanding and the connection to military and veteran experiences that our students can have. Working in the field of mental health is significantly rewarding. It gives you an opportunity to continue the mission of taking care of your people. And the most important part about that is also taking care of their own mental health, because that's what enables you to be available to others and to be able to help our military veteran populations and their families.